Good evening, ladies and gentlemen. My name is David Heckman, and I am here on behalf of the Monroe County Citizens Against Cardiovascular Disease. We are an all-volunteer organization consisting of 100% Monroe County citizens stood up by the Monroe County Health Department to provide a staff of medical professionals to focus on the prevention of cardiovascular disease in Monroe County. I attended Ashford University and achieved my bachelor's in health and wellness degree in 2016 and am the current president of the Monroe County Citizens Against Cardiovascular Disease organization. Myself and my fellow healthcare professionals wish nothing more than to create a healthier and more educated community. So the first thing I'm going to do tonight is discuss the public health issue that we are fighting against right now. According to the World Health Organization, cardiovascular disease remains the number one killer of people around the world. An estimated 17.5 million people died from cardiovascular disease in 2012, representing 31% of all global deaths. Of these deaths, an estimated 7.4 million were due to coronary heart disease and 6.7 million were due to stroke. According to the CDC, of those 17.5 million deaths globally, 610,000 were Americans. This continues to be a very serious problem we need to focus efforts on before this epidemic continues to ravage our states. A very serious part of this problem, we believe, is that the problems with this disease are starting at younger ages. Younger children are exposed to unhealthy eating habits and unhealthy exercise habits at a very young age. People are being sat down in front of TVs or sat down in front of video games or computers and just left there instead of being outside exercising. This means that by the time they are adults, they are even more susceptible to this killer. We as a nation need to begin changing our habits to more positively affect the habits of our youth. And this starts at local levels. We all know that the children of our nation learn from the habits of the adults, so we need to start setting a better example. Next, I'll explain the proposed public health policy. Our proposed policy will affect every citizen of Monroe County if they choose to involve themselves. There are 3 sections of our proposed policy. We're proposing healthy lunches for students, public fitness center, and fitness and diet information groups for those who are uneducated and wish to learn more about healthy habits. The first section we're going to talk about very briefly is healthy lunches for students. What we are proposing is that students have healthy lunches available to them. It has come to our attention that many parents are not happy with the food choices that schools are providing. So what we want to do is bring in healthier options, more natural and fresh options into our community school cafeterias. The lunch cost will be added to property taxes throughout the county, and we believe that this modest tax increase will greatly benefit the lives of our county's children. There will be no processed food allowed to be used for school lunches, so everything will be fresh. And according to Mayo Clinic in 2016, a diet rich in fruits, vegetables, and whole grains can help protect your heart. Aim to eat beans, low-fat or fat-free dairy products, lean meats, and fish as part of a healthy diet. And this all starts at a very young age. This can start at kindergarten and go all the way through senior high school, and then starting after that and just continuing to roll into adulthood. Our second section would be public fitness for the citizens of Monroe County. So similar to having a public pools or public parks, we're proposing that the county spend some of those funds to build fitness centers throughout the county for its citizens. While parks and pools are important for the enjoyment of our youth, I think it's very important too to have a place where families feel comfortable to go exercise as a family. It will also allow citizens more affordable fitness centers to attend. So with being county citizens, we're hoping to keep the cost down for those citizens so that they have a place to go without feeling like they're paying too much to go to a fitness center. The fitness center is also going to host the fitness and diet classes that we discussed previously. So we'll have trained staff at the fitness center to provide fitness coaching as well as dietitian help. And according to Mayo in 2016, physical activity can help you control your weight and reduce your chances of developing other conditions that may put a strain on your heart, such as high blood pressure, high cholesterol, and diabetes. And those all go along with cardiovascular diseases. So our plan is that starting with healthy foods in the school and then moving into fitness centers for families, that we can continue to control this problem at a younger age. And then already mentioned, our third section is the fitness and diet classes for the uneducated citizens, or maybe people that just want to learn more about fitness or how to cook healthy. We are proposing fitness and diet classes for citizens that are uneducated. So that might be someone that has only been exercising consistently for a year and they want to learn more, or they just started trying to cook healthy, but they don't really know what road to go down. So our dietitians and our fitness staff would help these individuals create better habits for them and their family. Like I said, there's going to be classes separated for different ability levels, so people don't feel ashamed to go to a class that might be above their level and they just have no idea what's going on. So we're going to involve people at different levels so that they don't feel frowned upon. There will be classes on home-cooked healthy meals and how to cook affordably. I know that one issue that people have is they think going to the grocery store and buying fresh foods is so much more expensive than buying processed frozen foods. And that's not necessarily the case. You just have to know what to look for, and that's where our dietitians are going to come in. So the impacts of the proposed policy, right now we're not sure what the absolute impacts are going to be. What we are hoping for is to achieve a county of fewer people suffering from heart disease, obesity, and overall poor health. So we're just looking at improving the health of our county citizens. We are also hoping that by starting at the school age levels, we will begin education at a younger age so that this may possibly be a problem of the past. We know that bad habits are hard to break, but we believe working together is our strongest option. We must work together and encourage everyone around us to do the right thing and take care of themselves, their friends, and their families. Most of the costs of this proposal could be covered by a modest tax increase to our citizens in Monroe County. We are proposing a 9% property tax increase for residents in Monroe County. We are confident this increase will cover the cost of meals for students and for the building of the new fitness centers. There will be an added cost for employees to manage the gym, but we are confident our county board will see the benefit of hiring 10 staff members. These minor costs, we believe, will be outweighed by the benefits provided to our community. I, along with my fellow staff members, believe the only risk here is not enacting this policy. We are risking the health of our entire community if we do not begin to take action now. According to the World Health Organization, prevention of heart attacks and strokes throughout a total cardiovascular risk approach is more cost-effective than treatment decisions based on individual risk factor thresholds only, and should be part of the basic benefits package for pursuing universal health coverage. Even the slight tax increase in our opinion, is nothing compared to the rising cost of healthcare and costs associated with losing work, medical bills, and even costs of funerals. The lives of the citizens of Monroe County will only change for the better if our policy is accepted. With access to the 3 sections that have been proposed, our community will benefit in a very significant way. The most important message we want to get across this evening is that the health of our community, and most importantly, the health of our children, depends on making changes for the better, and this proposal would allow us to do that. Help us in assisting Monroe County get healthier and have a long, bright future. Lastly, I would like to personally thank you on behalf of all the members of the Monroe County Citizens Against Cardiovascular Disease for attending this evening. We are hoping that you will all sincerely consider our proposal and see the benefits to our citizens. Thank you.